Hello, everybody, and welcome back to the older adult version of PT on Ice. I am Christina Previtt. I am one of the lead faculty in the modern management of the older adult course with Mr. Dustin Jones. And I agree with him. Last week, he was talking about trying to find a really cool name for the older adult day for PT on Ice, and I'm still kind of trying to wrap my brain around something that might be cool. I hope you guys are having a wonderful, wonderful summer. We are wrapping up. We are in week 7 of 8 of our third cohort of the Modern Management course. And so it has been going really, really well. Good morning, Kelsey. Thank you for listening. It's going really great. We have our next cohort starting in September. So if you're kind of on the fence about jumping in, you should definitely do it. It's a great course and we have a really fun time talking about all things Jittery PT. And so today, this kind of came up a little bit in one of our discussions, but it was also something that I've thought about a lot, being in both research and being only about 5 years out from school. And that's this idea of fear on the side of the clinician when you're working with older adults. And so, when we talk about the research, we talk about the fact that we need to be making our older clients essentially faster, stronger, more resilient. And we know that what the research is saying right now is that we need to be applying these high intensity exercise programs. We need to be pushing our older clients. The APTA was talking that underdosing exercise programs is one of the big problems that we're seeing across the board in physical therapy, irrespective of setting. But when it comes down to it, I think there's a couple of barriers that we are seeing, and some of them are on the side of the clinician. Some of them are on the side of the environment or the community that you're in, and some of them are on the side of the patient. And so when I was a new grad, I knew the latest research. I was probably the most up to date that I was with the current literature. And I knew that I needed to push my clients. But especially as a new grad who was trying to get my bearings and realize what I needed to do, I would take a look and do a medical review before going into the client's room if I was working in an acute care setting, or just the intake forms that I was taking when I was in private practice. And I was like, oh man, there is a lot going on here. And if you've been working in PT for a while, you know that oftentimes now we are dealing with so many things in terms of a person's medical history that it isn't simple. We're seeing some of our older clients who don't just have one issue. They have an orthopedic injury that's compounded by diabetes and cardiovascular disease. There's some subclinical cognitive issues going on. And for anybody, not just a new grad, I shouldn't just say it as a new grad, I think it can be really intimidating because our first goal is do no harm. And when there's a lot of things that are compromising a person's medical status, I think it's a very fair feeling that we don't really know how far is too far. And we want to make sure that we aren't going to make any of our other medical issues, the medical issues of our clients, worse. And so what do we kind of do? And then, so now not only is it that people are having all of these chronic conditions, now we're struggling with the concept of polypharmacy. So we're seeing people who have multiple drug interactions. They're on these cardiovascular medications that are affecting their response to exercise, and we need to be conscientious of that. And these side effects, we don't know. Some of the side effects, for example, of some of the cardiovascular meds are muscular soreness. So we don't know, is the muscular soreness coming from the exercise program that we're pushing it too far? Or is it a side effect of the cardiovascular medications? Or is it that they're just not in a very good recovery state because of all of this other stuff that is going on? And then we add another layer and we talk about some of the psychosocial considerations, there may be, I mentioned it a little bit previously, there might be some underlying cognitive issues. So if there's cognitive issues, then we are dealing with a whole other kind of vein of thinking in terms of how we're giving feedback and cueing these individuals. There may be some psychosocial or mental health considerations. Somebody may be experiencing some underlying depression or anxiety. We may have individuals who are socially isolating themselves because of not necessarily transportation issues, but because there's these underlying mental health issues that are coming up that may be needing to be addressed and needing referral. And then we have a bunch of chronic conditions that are going on. We have polypharmacy that is making us a little bit nervous. We have some psychosocial stuff going on. And then we have the idea of the client. And I know one of the things that I deal with a lot is that people tell me, Christina, I'm 75 years old. And their idea of physical therapy is responding more to passive treatment potentially, or being able to do 30 reps of their exercise program in one go and not doing necessarily 3 sets of 10 or 3 sets of 8 as we've prescribed it, and the intensity has been relatively low. So we're challenging preconceptions and beliefs by pushing people a little bit further. And so there's all of these things that are going on. And I know that when I was first starting in this arena, it was something that was really intimidating to me. And I think acknowledging that this sometimes is not the easiest, what can seem like a minefield to navigate around, and recognizing that this is going to be something that is going to be a moving target. It is something that as clinicians, we're going to try and work every day to push our individuals a little bit further. And as we get more experience underneath our belt, realizing that just like any of our manual therapy techniques, starting to implement these higher, not necessarily super high intensity, but higher intensity exercise programs is just like learning a manual therapy technique. And the more reps we get under our belt, which includes making mistakes or making people a little bit more sore than they would be comfortable with, and having those conversations and having practice, providing that education to these individuals is going to be really, really important, and something that, as we continue to have these conversations, and it's a more common construct, especially when we're talking about geriatric physical therapy, that it's going to get easier and easier. So there's a couple of things that I wanted to break down that has made it a lot easier for me as a clinician to start implementing some of these programs. And so the first thing that I wanted to talk about is oftentimes what's on the medical chart does not necessarily translate into the function of that person. There's been many times where I have done a chart review before I've interacted with the person for the first time, and my first reaction is, whew, there is a lot happening here. And so I get a little bit nervous, and I'm like, okay, there's 5 or 6 things going on, things that I'm going to have to be aware of. All of the clinical practice guidelines are starting to go through my head. And then I meet the person, and they are managing much better than what their medical chart may say. And Get PT First has made this hashtag, "You're not your image." And so I almost want to flip it and say, you're not your medical diagnosis. And what I mean by that is you may have a whole bunch of different diagnosed conditions, things that we need to be aware of from a pathophysiological perspective. But that's not to say that a person is like, I don't want to make these underlying assumptions about an individual's current physical function based solely on their medical history, or be very nervous or conservative and without that interaction. So realizing, and the more that I would see a complex medical chart and then realize that people are managing relatively well, that kind of used to give me a lot of ease of mind that I could continue with my orthopedic assessment or continue with some of my exercise-based prescriptions relatively easily. And another thing that I always start with is when I'm going through the assessment, we've talked about this in previous PT on Ice podcasts, is I establish the traffic light. And the most important parts of the traffic light are those red and yellow lights. And what I mean by this is if you're seeing a complex medical client, the first thing I try and make sure that I'm aware of is any absolute contraindications to exercise, aerobic or resistance training, and things that I'm going to have to proceed with caution. So the absolute contraindications are those red lights. These are those things that we know a person is, for example, has an unstable cardiac status and may require more medical monitoring or may not be able to participate in an exercise program at this time, or would have to start at a very low intensity because their medical status is so volatile. So physiotherapists that work in acute care settings, for example, are going to see this a lot, where this compromised medical background is going to be the main determiner of, is physical therapy a go today or is it not a go today? So that, and when we're in outpatient, I would say that I've maybe once or twice had an absolute contraindication to any sort of movement. And so usually we're okay with that. It's when we start getting into the yellow lights. So for example, if I have somebody who is currently changing blood pressure medications and diabetes medications because they are having cardiovascular disease flare-ups or any sort of diabetes management issues, then I need to make sure that I am on my, like Richard Severin's Vitals are Vital. I am making sure that I am monitoring their cardiac status. I am like checking their blood sugar or making sure that they check their blood sugar right before they get started, especially if they're having these swings, right? Where they're going into a hyperglycemic state or a hypoglycemic state. This is just an example as we're going through some of our strength training. I will also, in this yellow light, if I have a complex client who has never done any sort of aerobic or resistance training style program, I will be even more conscientious because sometimes they could think, for example, that they're just fatigued from exercise, but it may be a change in cardiac status or their blood pressure, their heart rate. They're starting to have postural hypotension if we're going from sitting to standing. These type of things that they may not be aware of and may think are just a result of the exercise program, but have much more to do with some of these fluctuations in their medical status. So things like that, I will really be cognizant of. And with these yellow lights, the things that I tend to go to the most are some of the clinical practice guidelines that have already been established, and I start there. And this can be really complicated with multimorbidity, but we know that some of the underlying pathophysiology and the way that these chronic conditions develop are largely the same. It's largely an inflammatory process that occurs over time, whether that be dementia, cardiovascular disease, peripheral disease, stroke, all these type of things have that underlying inflammation. And so I start with some of the cardiovascular disease guidelines that are outlined by either the American College of Sports Medicine. The Canadian Association for Cardiac Prevention and Rehabilitation also has a very comprehensive guideline that is there for cardiac rehabilitation. And so I make sure that I'm okay with those standards and then start applying some of my therapeutic exercise on top of that. So it's almost like I'm creating this layer because oftentimes with some of my medically complex clients, I am working in that yellow zone. I am in that proceed with caution for a lot of my exercises that I'm prescribing. And then I always try and add the green light so that you can go ahead and do stuff to give my clients confidence. Like I want them to see that, as a medical profession, we always are very cautious to warn people we don't want things to get worse. So sometimes it's nice to have a medical professional who will say, no, like you can do this. Like I'm totally okay with you doing this or going for a walk or being more active or, just potentially bringing a pulse oximeter with you if you're having some issues with lung capacity and making sure that you have a walker if you need to sit or things like that are going to be beneficial but are going to allow our clients to have a little bit more self-confidence in their physical capacity and their ability to get around their community and be able to do things like that. And then so first thing is I want to make sure that I'm not biasing myself essentially by looking at their medical history and having this preconception of what they're going to be like functionally. The second thing is, given their complex medical history, we're going to make sure that we know red and yellow lights that we have to be on the watch for so that we can make sure that we are safe and that we are keeping our clients safe with our exercise programs. And then the third thing is we need to get a little bit of we need reps under our belt. We need to try different things. And sometimes I'm like, oh, well, let's try and get this person to do floor transfers. We start working on some of the progressions and I'm like, okay, we're stopping there. It's not something that is going to be feasible. And then on the flip side, I have another person who I'm like, okay, we're going to have to be very, really slow with floor transfers. But then the first day they're like, oh, well, I can get up and off the floor. I do some gardening. And they show me their method, and we may do some tweaks to make sure that their joints are safe and that they're not flaring up any underlying orthopedic injury, but they surprise me. And I think that is the biggest take home that I wanted to speak to you guys about today, is that even though there is so much going on, and there are drug interactions and polypharmacy and complex medical histories, I would say that more often, especially with me being in outpatient orthopedics, people surprise me. And I'm learning to not be surprised by the amount that people are capable of and the amount that I can push. I use an RPE scale, so a rate of perceived exertion between 1 and 10, and I try and keep them, I start keeping them between 3 and 5, push it to 4 to 6, and then with certain components of my exercise program, I will have them up at 7, 8, and then bring them down to 4 to 6 between, while they're starting to accumulate more fatigue and I'm a little bit worried about form breaking down. And they do remarkably well. And it gives me so much satisfaction and so much just a love of working with geriatrics, and because I can give them a lot back. And we can have these conversations that don't have to be around medication switches and all these type of things. We can have these conversations where we can say, well, what do you think you can be capable of? And how can we get you back to all these things that are really important to you, irrespective of your medical diagnoses? Or how can we optimize where your function is now if potentially getting back to some of those things isn't a realistic expectation? And we can start having those conversations, but they're in a positive frame of mind and a positive mindset that I think is really, really rewarding and something that I love doing as a physical therapist. And I'm very lucky. I have a whole gym attached to my business. But even setting up an exercise program for people at home, some of our home health physical therapists have a huge role to play in being able to optimize some of their function and get that capacity back. And I think at the end of the day, my feeling of fulfillment and being rewarded and by seeing my clients succeed has slowly edged out that fear. And it's been pretty great. So I'm going to leave with that positive note for today. I hope you guys have a wonderful Wednesday. Enjoy the rest of your week. Enjoy the weather. It has been raining for the entire week up here in Canada. We're in Kingston, Ontario. So I hope that you guys are having sunshine. And we will see you all in a couple weeks. Bye.